Welcome to Crushing Doubts Q&A every Thursday at 6 p.m. Eastern, 3 p.m. Pacific. I am here to talk with all of you, of course, about mind-body issues. All of those symptoms that come up that doctors can't explain, anything where your body can do it, the mind can use it. And we're going to talk all about it. Included in that discussion, of course, and this is especially for people who are new here, I have a system that I've developed. It's called the column system or the 3-column system, or sometimes columns work. It's referred to in all kinds of different ways. And the main idea about it is that there's 3 different ways that we can understand how symptoms are operating within each of us. And my job is to help you see which is operating when and why and what to do about it. And so that's what these questions are about. Now, I say this every time, but I do want people to know about these things. I have teaching seminars. They're on pre-recorded videos right now. I will be doing live ones again once I get the book fully edited, which I'm working on. But you can use these seminars to learn all about mind-body issues. And that includes all of those questions you have about why does one person say this in the mind-body field? Why does another person say this? It can be very confusing. I know that it was that way for me. So these seminars can help with that. I also just created a new introductory course. This one, the seminars are eight sessions long, and they're each 75 minutes. So it's a lot of information. If you want a short amount of information that gives you the basics, I created this introductory course. And the way you can access this right now is to go to my website, www.crushingdoubt.org. At the bottom of that front page, you can join my newsletter. And the newsletter has made the announcement of and the link about where to go for that. But I'll also put it in the chat here so that people can go straight there if they want to. And last but certainly not least is the group membership, because the group membership is a way that each of you can work directly with me. It's Mondays, Wednesdays, and Fridays. You can come 1, 2, or 3 times a week. And when you do that, you get to ask me questions in a way that's a little different than this. You can ask questions here, of course, as well. But there's a lot more give and take. I say, wait, hold on. What did you mean by that? No. Okay, wait, hold on. I see this observation. And there's a lot more give and take in a rapid fire way that can get you guys a lot of answers. So if you want to talk to me about any of those options, do let me know. You can email me, dan@crushingdoubt.org, or check it out on the website, or ask questions here. So let's get to it. Now, I got to say hi to some people. Catherine Toomer has joined us. Rita, good to see you. I see you said hi. And Rody Jangles is with us on Instagram as well. Good to see you all. Now, we've got a comment coming in from Lynn Slavensky. Hi, Lynn. Okay, Lynn says, completed your 8-hour video course. So that was the seminar. Great. Fantastic. Glad to hear it, Lynn. Looking forward to group. Started themes and doubt list. Okay, this is really exciting, Lynn. I'm really happy that you took the initiative to jump in there. And I'm equally happy that it seems like it made sense to you. You know, there are times where even with my information, which I do try to make as clear as possible and as useful as possible, sometimes people have questions afterwards and need to ask them. And other times I hear people are saying, oh, this was much clearer than what I've heard in the past. And Lynn, it sounds like you might be in that group, which is good to hear. Either way, we can get your questions answered. So what Lynn is referring to when she said started themes and doubt list, she is referring to in the emotions column list. What I recommend people to do is to come up with what I say around 6 to 12 themes. It doesn't have to be in that number, but that's a ballpark estimate for what usually helps. And I can say more about why. And you develop the kind of themes that suggest this is the kind of thing that upsets me, and this is the kind of thing that upsets me. And you go through, and you should be able to look at that themes list and say, that's me. This describes my emotional ups and downs right here, especially the downs. Those themes should nail it. Okay, so Lynn, we're going to work on that in group as needed. Then she said she started a doubt list. Well, in the doubt column, you are trying to get your doubts put into words. I say you observe them, articulate them, and then counter them. But she's talking about the articulation part. Observing them means to recognize them as doubts, not as facts. Articulating is to get them into words. That's the part Lynn's on right there. And when it comes to countering, often people need help from me, and we'll dive right in, Lynn. So look forward to seeing you. It sounds like tomorrow. I do have a group Friday Fridays at 2 p.m. Eastern. So if anybody wants to join and come tomorrow, I'm available. Part of the groups is so that I'm always accessible. That's what I want for people. Okay. Tula, good to see you here. Tula says, Dan, I welcome help with the doubt and power column as I talk more, move around more, live life more. Normally, I'm noticing my body symptoms more and I get fearful. How can I bring doubt down? Okay. There's a number of different ways that you can bring doubt down, Tula, but this is something I'll say to you and to everybody. Each person's different. So I can give you an answer at the start, but I always want you to push back and ask the things you need to ask. So if I say something, don't just take that at face value. If you're like, I don't know how to implement that or that won't work for me, then tell me because I can tweak it for you. But one thing that I can say, Tula, is you're already bringing doubt down. And I want you to remind yourself of that. A lot of times people worry, I don't know if I can get doubt down. Guess what that is? That's doubt right there. Doubt is going to convince you that you're not winning when you are. And Tula, I know you're winning because I've seen you here at the Q&A and we've talked in groups as well. And you are bringing that doubt down. So what you want to do is just don't let doubt convince you you're not winning. Winning against doubt is not as hard as people think. It's just that doubt is tricky. It'll make you think you're losing when you're not. So that's the first step. First thing I'll say about it. Now, here's the other thing. As you move around more, you need to think about the fact that each time you move, it's a trigger. It brings doubt to the surface potentially. And what I want you to remember is this is a phrase that has always helped me. It can hurt, but it cannot harm. Nothing bad is going to happen from any of this stuff. You could have a symptom flare up. That can happen. But as long as you continue to move forward and hammer these symptoms, they're going to die down and they're going to have to settle for less over and over and over. That's what happens with doubt. You're winning that battle. I just need to keep reassuring you of that. And by the way, that's another thing that I'll say in terms of how can you keep doubt down. The groups are incredibly helpful for a number of reasons, but one of the reasons they're helpful is I am there to hammer doubt with you, and you don't have to do it alone. I wish I had had that when I was getting better. I did have to do it alone mostly. I got a little bit of reassurance here and there, but mostly not. And I know how important that reassurance can be. And by the way, I don't just give reassurance just blanketly. I tie it to something that can show you, look what you did. Look what you did. Look how it's going so that you can actually feel reassured. So a couple things. Don't let doubt get you to worry that you're not winning. Recognize movement as a potential trigger that cannot harm you and is a potential step forward, because every time you conquer one of those, you take a step forward. And thirdly, you don't have to do this alone. Now, there's more I can say, Tula, but let's start with that. Okay, Tula says, go, Lynn, go. I love that we cheer each other on in this community. Thanks so much, Tula. Tula then says, by the way, new house in Arizona almost closed. So this is one of the stressors that you have going on, Tula. And it's very common for people to have symptoms, mind-body symptoms, not just around hard things, but around good things. And sometimes a good thing can feel hard all at the same time. So this is an example of it. And I just love to see that you're moving forward with things, Tula. You're starting to move. And in this case, literally, you're going to be moving to a new house. So there's movement happening. And that's what we want to see. Okay, good to see it. Now, Catherine Toomer says on Instagram, hi, Dr. Dan. I'm lying in bed with COVID. I'm sorry, Catherine. COVID is no fun. I can tell you firsthand. Third day, I took 3 of 10 doses of an antiviral. But I've quit due to hearing about the rebound COVID that can happen 2 to 10 days later. So we'll see what happens. I want all the answers about COVID infection and contagion, but there are very few sure answers. Probably good for me to practice being in wonder and curiosity rather than panicky to know everything. Okay, great observations, Catherine. First thing I'll say is I'm sorry. It's no fun having COVID, not just physically, but mentally and emotionally. We've heard so much about it. I found it to be very challenging psychologically as well. And hopefully, my hope is that you get a kind of lighter dose and it's not so bad and it can just go away. But here's what I want to reassure you from a doubt side of things, because doubt can rage when we have all kinds of situations. But one of the situations where it can rage is when we have something that's a clear illness or a clear injury. Doubt can pile on top of that. So here's the thing I want to tell you, Catherine. You could investigate whatever you want, but what I want to tell you is that uh, COVID gets better. It really does. So have the confidence, particularly if your doctors are saying you're safe. There's nothing to worry about. Don't overthink it. Just know that your body will know what to do with this. It knows what to do with all of these different things. So I find that if you start investigating, you can go down a rabbit hole. Uh-oh, I heard this. And these are all triggers for doubts that we're getting. So a lot of times I don't even want to know because I just fall back on the fact that the body heals and we get better from illness and I don't need to worry about it so much. So just make sure that you're doing the things you need to do to stay medically safe, stay in touch with your doctor, drink lots of fluids, and you're going to be totally fine. That's true, by the way, if you decide to take the antiviral, the rebound effect isn't necessarily so bad anyway. Just might mean that could happen and you could not feel well for a couple of days. Nothing bad is going to happen. So try to remember that, Catherine, and hopefully that's helpful, but let's do follow up as needed. I do like your statement about being in wonder and curiosity rather than panicky to know everything. But I find that one of the reasons that my work tends to be effective with people is I give people reason to be in wonder and curiosity and not panicked. And hopefully I just did that, Catherine, but please do let me know. Okay, Chrissy Lynn Eden, good to see you here. Hi, Dan, it's Chrissy. I'm still dealing with my dog's dementia and the tough decision on to keep dealing with this stress or losing him. New symptom, next line. Hold on. Okay. My left arm muscles really hurt a lot. I thought I was having a heart attack, but I couldn't be for 5 days. Bingo. That's the kind of observation that people need to make. I understand how scary it can be to have such symptoms. I've even, had kind of panicky symptoms that made me think, oh, is there some kind of heart issue? But the thing is, you got to weigh it up against science and logic. If you've been having it for 5 days, nope, that's not a heart attack. Now, if you have any doubt about it, really, go check with a doctor. They can rule out things that are life or death. They're good for that. But beyond that, they're not good at recognizing what's a mind-body symptom. If they've ruled out life or death, you're fine. You're going to be safe. And that means it's a mind-body symptom. So now you said, what's that about? Let's see. Hold on. Do you say something further about that? Also, my walking is better, but still not right. I still think this is a structural issue. How can we prove it's not? Okay, hold on. Let's back up to what's that about? So, guys, whenever I answer a question, and this is true in the Q&A or in the groups or anywhere I answer a question, I like to answer the question for the person who asked it and also for the rest of you. So let's think about this. Chrissy's talking about a symptom. It's gone on for 5 days. How do I think that through from a column's perspective? Well, here's the way I think it through. The onset and uptick of any symptom is from the emotions column. So I look in the emotions column. 5 days ago, I want to know what led to that symptom spike. That's one clue that you have to figure out what's happening. Something was going on there, and it's something specific. So that's one place that I'd look. The other thing that I look for, because this is the only other way that there can be a symptom onset, is if there is a doubt trigger, meaning a physical activity that made you worried about your arm, worried about your heart, something like that. A trigger alone can get a symptom going. So it's one of those two things that happened 5 days ago. And it's almost always emotional when it starts out of nowhere. When it's a doubt trigger, you're usually aware, oh my God, that just happened. Oh, I'm worried about that. It's very, very obvious. So this sounds like an emotions column symptom 5 days ago. And then doubt comes to pile in on top of it. That's exactly how these symptoms work. It's why doubt is so important. We have to take doubt off the top so we can get back to thinking emotionally and understanding what happened to us. What's this about? So you asked the question, what's that about? And what I've done is with the column system, giving you some guidelines about how you can find out what it's about. I don't know what it's about specifically, but we can find out. Particularly if you come to group, that's another kind of thing where I can just really nail it right there because I can ask you some questions. I can say, what was going on? You could give me a list of things. I say, hold on, tell me more about that. My instincts are going to play more of a role in that group even than they are in the Q&A because I have a chance to use my intuition and ask certain questions and gather more information. We can find out exactly what that symptom is and make it go away. But ultimately, this is about building confidence in you that you can do it all. Now, when you said, Chrissy, also my walking is better, but still not right, I still think this is a structural issue. How can we prove it's not? Okay, listen, I don't know that I'll be able to prove it right in this moment as we're talking about it, but let me bring up a little inconvenient fact for doubt. If it were structural, why are you getting better? Now, it could be that you're doing something, some kind of treatment, and you feel like that's leading to it getting better. That's would be entirely possible, but based on what I know of what's going on for you, Chrissy, we're bringing down doubt and things are getting better and things are shifting. I've seen it. You've told me. You've even said sometimes the symptoms are different. Even if they're not all better, they got really different. And then you got worried, well, maybe there's something new going on. But each time we brought down doubt, we shrunk the area in which it can work. And a lot of these symptoms start to shrink. And that's exactly what happens when we bring down doubt. So you say, how can we prove it's not? Well, the good news is, I find, is that if you work against doubt, you start to prove it's not because the proof's in the pudding. You start to get reduction in symptoms. It starts to shift around just from talking. That doesn't happen with a structural issue. So that's my first answer, Chrissy, but I want you to follow up as needed, okay? Push back. Let me know. Okay, Vicky Schmidt, good to see you on Instagram. Thanks for joining me here. All right. But as I said, Chrissy, do some follow-up questions if you need to. Jane Smith says, hi, Dr. Dan. Thanks again for being here for us. You're always very appreciative, Jane, and I appreciate that. The appreciation keeps me going. If I've discovered what works best for me for an uptick is to do a somatic exercise as my first go-to, is that okay? And then look for the emotions second. Absolutely. That's an example. And Jane, you and I have talked about this, the system within my system. That's part of your system within my system. You know what you need. There's all kinds of different things you can use to get help. And what I want to encourage you is go ahead and do what works for you. Now, if it doesn't work for you in a given moment, then we need a new adjustment. But this is a part of your system. You're saying it works best for you. And you know what? It makes sense. For some people, calming down the body before they even go and look for the emotions helps. For other people, it can be the case that knowing there is something that emotionally makes sense and is the thing that does calm down the body. And then there's people who have it one way or another at different moments. So let's think about that. Okay. You have a kind of different setup than every other person. And you even have a different setup than yourself at certain moments. If it's working, use it. It's working, Jane. Use it. Let me know if that makes sense to you. All right. Karen Isaacs, good to see you here. On topic of reassurance, it's everything. I used to call Dr. Sarno every couple of months. I even went to my TMS therapist for 9 years, but your reassurance in this group is so helpful for the reassurance. That's good to hear, Karen. Thank you for sharing. And then she says, you taught me, gave me tools for me to reassure myself. So listen, that's part of what I do. My goal is not to simply be here for reassurance all the time for each of you, though I am. That's part of my function. But if I can build that in so that you're doing it for you, then you end up doing exactly what I ended up doing for me. And sometimes what I even need other people to do for me. I say, okay, wait, what would I say to me right now? And I need to hear it from the outside. Reassurance matters. And Dr. Sarno, it was a big part of what I gathered from his book is that, his book, many people, they don't just read it once. They go back and read it again. And why do we go back and read it again? It's not usually because we've forgotten everything or we don't agree with it or we, don't understand it or need to go over it again. It's because it's reassuring. I love that it's there. I actually haven't gone back and read it for years, but I always could. And I'm even finding the same about writing my own book. It's reassuring. It's reassuring for me. I'm like, oh yeah. Oh wow. Yeah. I forgot about that success I had. Oh yeah. I forgot about this study that I read about that was so compelling. It's good to have lots of ways to reassure yourself. So have a good book that helps you with that. Come to me, get that reassurance. And like Karen says, learn to reassure you. That's great. Okay. Tula says, Dan, you're right. Doubt gets me like this. When you get better, you'll overdo it and get sick again. Will ask in group. Meanwhile, huge win, swam a mile 4 times, 4 times and 6 times. I don't know which that is, but I can tell you did something you didn't think you could do. That's the key. And it's such a big part of getting better. It's even true through real physical injuries when people go to, let's say, physical therapy or something like that, which, sometimes people go and they're not getting the right messages because that person doesn't understand a mind-body perspective. But even when they are doing a good job and giving these recommendations and saying different ideas, the ones who are reassuring and the ones who help you master doubt, essentially, by saying you are going to get better, I see improvement, that helps. And Tula, you're starting to do things that you didn't think you could do. Now, I want to look at this statement. When you get better, you'll overdo it and get sick again. I want you to remember that's only doubt. There's actually no danger of that. You're in no more danger than anyone else of having symptoms flare up. And even if you did, it wouldn't be because you overdid it. That's not what's happening here. As we get you to believe in that mind-body experience even more, you're going to recognize there's nothing to worry about here. I can't hurt myself. Something could end up hurting for a time, but I can't damage myself. And you really can't. Temporarily, if you had a major injury that you're recovering from and you pushed it, okay. But injuries all are better in under 12 weeks, all of them. A severely broken bone heals in 12 weeks. You're past all of that, whatever that was. Even if there was an actual injury, which I'm not saying there was, but if there was, you're well past that. You can't overdo it. You're not. This doubt it loves to prey on us, saying, yeah, you're fragile. I don't know if you can do this, because that then it allows it to cement its role and stay there. Okay, Tula, let me know if that makes sense. Okay, Rita said, I think DNSR talks about that overdoing it, in quotes, concept. DNSR, by the way, I believe is Howard Schubiner's program. Howard is fantastic. Fantastic in the mind-body field. He and I differ on certain ideas. They tend to be kind of small ideas, but sometimes even a small idea can really drive a wedge for people in their belief system. So Rita's talking about one of these. I think DNSR talks about that, quote, overdoing it concept. Maybe they are referring to spiking fear. And that might be, that's what I hope they mean. I've heard good things about DNSR overall. I think Howard's wonderful. But if there is language that you hear about, don't overdo it physically, that's something. The only way that you can overdo something physically is if you are in a very acute recovery phase of a very short-term symptom. In that case, you could overdo it a little bit, maybe set yourself back a week, that sort of thing. Oh, this is not Howard. Let's see. No, I meant the Annie Hopper one. Not an expert on this. LOL. Okay, Rita. Sorry about that. So, tell me more about the Annie Hopper one, Rita. I don't actually know about it. But in any case, you want to be thinking about, does this person make sense in what they're saying? And if they're bringing up things like, you could overdo it, it's a very, very acute phase that you'd have to worry about overdoing it, and you wouldn't damage yourself much. You really wouldn't. I mean, the body is pretty indestructible. Evolution is there to make sure we're better and better. Our body can handle a lot of stuff. It's all about what we feel we can do, especially once we're past very, very acute injury phases from obvious injuries. And some of those obvious injuries, meanwhile, are triggers. They're not even actual injuries. So we got to watch out for that as well. Okay, Catherine Toomer says, thank you, Dr. Dan. I am confident of getting well. Good. A question. I can go years in the presence of sick little ones, preschool teaching, and not get sick. But then in the last 3 months, I've gotten 2 colds and 1 COVID. So couldn't TMS be involved in this frequency coming? Okay, I'm going to give you my opinion, Catherine, and then I want people to weigh in as needed. And Catherine, you push back with questions as needed. TMS, as Sarno called it, tension myositis syndrome, it originally was about the soreness of the musculoskeletal system from mind-body issues. But it has come to be known as kind of a general term for mind-body issues. One of the things that mind-body issues can do is lower your immune system. This is not at all surprising to anyone. In fact, medical doctors will say all the time, stress makes you more likely to get an illness. And if you ask them, to describe why, it's because the immune system is lowered. So we all know this. But yeah, that's exactly what's happening here, Catherine. I think actually it speaks to you maybe feeling vulnerable. It might be while you're doing this power column work that you're doing. And it also could be that doubt is looking for a new place to hide because it lost its old ones. If I had to guess, I would guess that. Usually, doubt is very crafty and it will look for ways in. And it'll find the ways in that, and they may surprise you where you're like, I didn't even think I was worried about that. I didn't think I was wondering that. That's where doubt's going to strike because it's where it can strike. So, yes, I think this is a TMS issue of bringing down the immune system. I do want to be clear. I don't think that TMS is the thing that gives you, a cold or a virus or makes you get COVID necessarily, but it can make you more susceptible to those things. When I got COVID, it was the day that my dad, who's, my stepfather, I talk about having lost a father when I was a baby, but the one who adopted me, who I now call dad and think of as dad in many ways, he had what's called a transient ischemic attack. And I was there with him. And so like half of his face, it looked like he was having a stroke. And it's not an actual stroke, but it behaves that way. Well, that happened within about 2 hours of me not feeling so well. And I got hammered by COVID. And I can guarantee you a huge part of why I got hit that hard is that I had an emotional trauma happen right then. It was pretty bad timing. But I think the interaction between these two things is important to think about. So, Catherine, hopefully I answered that question to your satisfaction. Please do let me know. Okay, Rita said, sorry, typo. It's dynamic neural retraining. Okay, they basically repackaged old ideas. Okay. By the way, that's something that can happen a lot in the mind-body field. I find really we're all saying very similar things, even myself included in a certain way. However, there are two ideas that I am bringing to the table that I've not heard talked about, at least not at the level that I talk about them. One is how important doubt is. Some people talk about you got to accept the diagnosis. Some people talk about how maybe even mention the word doubt, but I've never heard anybody talk about it like it's paramount. It's dominating what happens in people's lives. And not only that, I found that that's true not just with mind-body symptoms. I find these columns work on a psychological level as well. If you're having doubt about your own reality or your own experience, doubt has room to play. It will play tricks on you. It will cause problems. It'll cause symptoms of some kind. The other thing is the power column. My emotions column is more similar to how a lot of the mind-body world operates, though I think it's got some more specifics to it to guide you. But the power column is something different entirely that I really haven't heard talked about either. And it's something I discovered by getting better. When I got better, I felt so powerful. And I was like, that can't be a coincidence. And as I kind of reverse engineered it, I found, yes, you can use power and finding your way to power to actually make your symptoms better, especially around plateaus. Happy to answer more questions about that if people have them. Okay, Catherine Toomer says, thank you. Yes, it rings a bell immediately that the susceptibility is related to the power column work that I'm doing. Absolutely. Sounds right on. Okay, so when people are doing big time power column work, it can be stressful. And we know, or at least I say it all the time, doubt can come crashing in when you're about to get powerful. So it does sound like that's happening, Catherine. So now that you're thinking about that, I don't think doubt's going to have as much room to play there. I think your immune system will probably start to do better. You can probably go back to not getting colds very often at all. COVID may be a different thing. I don't know how transferable it tends to be. Recent strains have been very, very contagious. Um, but you should have immunity now from having it. And so you should be in pretty good shape. So I find thinking about the immune system from a mind body perspective to be very helpful. All right. Lynn Slavensky says, when starting out working on emotions, is it best to start analyzing the onset or work on clarifying themes first? Lynn, you actually can't go wrong with that. I love your question for many reasons, but one of them is it highlights exactly the two areas of work you're mostly going to be doing with these themes. Sometimes you're going to be analyzing that onset and trying to figure out what it is. Other times you're going to be developing themes, but more and more you're going to move towards just analyzing the onsets because your themes are mostly going to be developed. As you're starting out, don't worry about it because you're winning either way. If you can maybe look at it, let's say you're looking at it and you're like, okay, I see that the onset was here, but I can't figure out what the theme is. Then toggle over to the other thing. Just start listing themes generally and see, did any apply there? That can help you. The opposite could be the case, though. You could say, I'm trying to figure out themes and I can't really, I don't know. Wait a minute. But I remember I had this moment where this happened and then I developed a symptom. What would that be about? So sometimes the onset helps you develop the theme. It does not matter which direction you move in. All roads lead to Rome, as they say. You keep working on this, you'll figure it out. Don't worry about it. Just focus on understanding the emotional connection with your symptoms in either front, and you're winning. I'll help you though if you want to sort out what's best. But just try some things out here at the beginning, and we can talk in group as well. Okay, thanks, Lynn. All right. Tula says, Rita is right. I learned about getting out of my training zone in DNRS. She says, thanks for clarifying. Okay. Yeah, thanks for sharing that, Tula. It's one of the things I love about this community is the fact that we can discuss all of these things. And I like to do it in a very open way. I don't want anything to be closed off, and I don't really understand why we would ever close anything off because the whole idea is to get to the truth. If you're going to have no doubt about things and you're going to be certain, then you need to be able to ask anything. You need to be able to wonder about anything. You need to be able to say, hey, this part makes me wonder. And that includes with my system. I encourage people, I often tell them, try to tear it apart because these are your questions. These are the things you're stuck with. Hopefully that is helpful. Not to be stuck with them, but to have answers. Okay, Karen Isaacs says, it's so satisfying when my husband embraces this. Fantastic. I'm glad that's happening some. He claims he believes in it, and he does. But then when he tells me about his quote unquote weird toe pain, I just make a know-it-all face. Let's see. Then Karen says, he then tells me how he tells the pain to get the F out of here. That's my go-to phrase and confident feeling behind it. Karen, first of all, I know what you mean. When people in our lives finally embrace this, we don't have to live in this kind of alternate universe. Really, they're the ones living in the alternate universe because we're the ones who are living based on truth and science and logic. They're in a delusion that the mind body thing is not actually existing all that much. So when they come to meet us there, it feels a lot less lonely. It feels more reassuring. It feels safer. If we could get the whole world to actually understand this, we'd all feel a lot safer. And so would they. They just don't know that yet, but we're working on it. But then when somebody says, oh, I have weird toe pain, or when people say, oh, I have a bizarre symptom. Whenever I hear somebody say something like that, I don't mean this critically, but I hear it and I think, okay, that person doesn't fully understand mind-body experience because the weirder it is and the more bizarre it is, the more likely it is to be mind-body. And in fact, there's nothing bizarre. There are no bizarre symptoms. Here's why. You have to think of, I say this kind of thing a lot. This whole thing, the whole body, is just an extension of your brain. If the body can already do it, and the mind is part of how it can do it, then why wouldn't the mind be able to co-opt it to do it for its own purposes? It's already in control. So it's going to do that. Now, one of the things about doubt is that's helping you master. Uh, this is something that came up in groups a long time ago, or fairly long time ago now. One of the group members said this really interesting thing. He said, I've thought about that we're focused on the fact that the mind controls the body. But a lot of doubt work is about I'm paraphrasing, I'm kind of saying it in the way that I understood it. A lot of doubt work is about the fact that the mind also controls the mind, meaning we think we're stuck with the way our mind's pattern is, but we can get control of that. If we understand why it's happening, then we can shift it around and get control of, well, what is the mind going to be thinking while it's controlling the body? And that's ultimately what we need. Now, Karen, I chuckle a little bit at this, you making a know-it-all face when that happens, because what else are you supposed to do? You're right. You do know it all in this case. And hopefully over time, he gets the message enough, not just from you, but from his own body and his own experience and his own observations, and hopefully ultimately from society, that people wouldn't say I have this weird toe pain. They just say I'm having a feeling. That's actually what my daughters say to me. I've taught them this. And, you know, like my oldest daughter recently said, "Oh, that made my elbow hurt. I must be having a feeling." I said, "What is it? What do you think you're feeling?" We explored it. The elbow pain went away. Now I'm giving her a skill for life, and I'm incredibly lucky to be able to do that. That I came across Sarno to discover this. But imagine a society where everybody knew this. Wouldn't that be great? All right. Jane Smith says, besides the doubt and power column, you bring a level of compassion, respect, and championing for each of us as individuals that is remarkable and touching. Also disarming. Jane, thank you for the very high praise. It really does mean a lot. Don't ever feel obligated to to give me compliments or good feedback, but it really is part of what I want to do. I never really understood, and maybe this is just particular to me, but I never really understood a world that needed so much aggression towards each other. Uh, I think we can support each other. W- I, I I don't know. I somehow knew inherently, I think maybe because of some of the traumas I went through, that one person being powerful doesn't make the other person less powerful. We can all be powerful. We can all support each other. We can all be our best selves. And I'm glad to provide that as much as I can, Jane. But thank you so much for sharing. Really, very meaningful to me. And these are the kind of things that really keep me going. So thanks for saying so. Okay, then Jane said, thanks, Dr. Dan. I'm still mulling over how to create my system within your system. It is definitely helpful for you to trust me so I can start trusting myself more. Okay, this is a very important um, piece of information that I can interpret and share with you all about how I'm thinking about this. The idea that I trust you is a big part of what works. Um, when I work with people, and actually this comes up especially when I train people in the work, which I do. If anybody's interested in training, please do let me know. You can contact me at dan@crushingdoubt.org. I'll have a new training round coming up in the next couple of weeks, probably. Um, but you know, as I work with people, I've had people observe. They say, you seem to really utilize well taking your cues from the person you're talking to. And that's exactly what I do. I don't have the answers, but I know that you do. And I know how to ask the questions and explore it in a way that we can get to that. So it's a huge part, especially of power column work, to get you to a point where you can trust you. And it's happening, Jane. I've seen you change, over the course of our talks here. I've seen you start to change. I know you're mulling it over. I know it's not easy to create the system within my system. You've got parts of it and you keep developing those things, but trust your instincts. One of the things I love about mind body work is that the body never lies and you can trust it. I say that the body is the most empathic entity we have. It's true. Your body tells you everything you need to know, and it's always on your side. It's the best friend you'll ever have. So there's no reason not to trust you, especially when it comes to symptoms and what they respond to. Thanks for sharing that, though, Jane. It is very moving. Appreciate it. Okay, Catherine Toomer says, Jane compliments you so well. I echo it all. Thank you, Catherine. I appreciate it. Tula then says, I'm clarifying my win because I felt powerful when you said it. I swam a mile a day for 4 days straight. Power. Tula, I mean, that's huge. You were scared to move in certain ways. I couldn't believe it when I started doing the Sarno work, and he said return to normal activity. And I thought he was just saying that um, because you could. But what I didn't understand at the time until I started doing it is, oh, it actually makes you feel those wins. It makes you see it, and it's undeniable. I mean, since we've started talking about this, you've gone from feeling afraid to move to swimming a mile a day for 4 days straight. And typically speaking, those are gains that doubt has lost. Doubt has lost that ground. It's not going to be easy to get it back. When I started playing basketball again, doubt hasn't won that back from me at all in years. And it just goes on and on. So keep it up, Tula. Bravo. Or I guess brava. Okay. Karen Isaac says, exactly, Jane. Dr. Dan's compassion, intelligence is so kind. My sense of mod, I'm starting to blush. But thanks, guys. I really do appreciate it. And, it's part of, they say, be the change you want to see in the world. Well, this is part of it. I love a community like this. In fact, I was just talking to somebody about this. I run a basketball league, and I sometimes catch flack from people outside of the league who get to join us sometimes, and they say, like, your league doesn't talk trash. They're all positive. Like, come on, like, where's your edge? And you know what I tell them? I say, that's exactly right. Yep. I didn't come here for an edge. You can go find that in a different game. The funny thing is I actually give them a little bit of an edge right there in my response, but I like to build a community where people don't need that because I understand what it feels like to not feel safe. And people who don't understand what that is like or are denying it in themselves, they think it's fun to, talk trash to each other, to tear somebody down. That's not fun. That's destructive and it's horrible. And then those people will pass it on. So what I'm hearing is not only meaningful to me and very, uh, makes me feel good, but it also makes me feel good about the fact that I'm achieving the mission that I want to, that we are setting up a community where we can help take care of each other. And when it comes to doubt, that's incredibly important because doubt will keep trying to get you. And if you're off balance, which the world throws us off balance all the time, even in the mind body world, it can be hard. But if you're feeling safe, then you can build. So that's what we're doing. Okay, Tula says, thank you, Dan the man. You are welcome, Tula. Thanks so much. So we actually have time for a preloaded question, which we have not had in weeks. So I'm going to bring one up and answer it here. Hold on one second. Oh, actually, Jane Smith had an observation. Karen, I think of you when I want to have Dr. Dan in my back pocket, as you were the one who first mentioned it. All right. Well, I am in all of your pockets as much as you want. Okay, here is a question from Laura. A few weeks back, you answered my question on the Q&A about a huge flare-up leading up to my daughter's wedding. The wedding has happened and everything went well. I realized that in the emotions column, I was having old triggers of abandonment and lack of communication. My doubt also came way down after the big event because I had such a huge drop in my pain. Witnessing how much the pain decreased has me realizing that it has to be TMS, crushing doubt in action. So, Laura, thanks for sharing this success story. Whether you're having a success story or you're having a struggle, as long as we can understand why it's happening, it's still moving forward. But it is great to hear success stories. This is an example of someone who was able to see that emotions column work in action. Oh, wow. It really was a flare up related to a specific theme. And when she got through it, that helped with doubt. Similar to Tula swimming, a mile a day for 4 days straight, that helps with doubt. It's proof that you can do it. It's proof that you're okay. And that's what we're going to keep working on. So, guys, I want to thank you for being here with me tonight. I'll be here the same time next week at 6 p.m. Eastern, 3 p.m. Pacific. And I say this all the time, but the key to you getting better is your questions. You getting your questions answered, things making sense. Now, of course, we need you to feel safe. To me, that's kind of a prerequisite that I do try to build in, and glad to hear it's going pretty well for many of you. And I'll keep working at that. But the bottom line is, how do you make sense of this all? Let's keep working at it. I can't tell you how much you guys get out of asking your own questions and how much I get out of it. In writing this book, a lot of it comes from the questions that people asked or I asked and the answers I found. So thanks so much for being here with me. Rita says, thanks, Dan. Good to see you, Rita. Thanks for being here with me. Guys, we'll keep it up. If you need my help, you can email me, dan@crushingdoubt.org. You can go to my website, www.crushingdoubt.org. If you want to check out the system, the introductory course is 50 minutes in total. It's 5 videos of 10 minutes in length each. And there is a discount code for people who have the newsletter. So I encourage you to go to the website, sign up for it. It's a good way to get the basic information. The groups are really thriving. We're doing great work there, and we're doing great work here. And I'm proud of you all, and I'm proud of what we're doing as a community. And let's keep it up. Thanks so much, guys. I will see you same time next week. Bye.